Hello friends, I am Dr. Pathik Parikh and I am going to talk today about myths of liver transplant. So there are a lot of misconceptions about liver transplants which I am going to help you understand and break these myths. So first myth is liver transplant is experimental. Now liver transplant is not experimental and it is already an established modality of treatment. So first liver transplant worldwide happened in 1967 and the first liver transplant in India occurred in 1998. After that, India has progressed in leaps and bounds in the number of liver transplants. In the last year itself, that is in 2023, around 5,000 liver transplants were carried out in India and the overall success rate of India's liver transplant is around 85 to 90%. So it is no longer an experimental technique. The second myth is liver transplant is a expensive modality. Now, liver transplant, yes, it is entailing some amount of expenses, but as compared to the rest of the world and Western countries, it is one-tenth the cost. So in India, you can easily get a liver transplant done between 15 to 30 lakhs. If you consider admission of the liver disease patients over a period of 1 to 2 years, they easily spend around 5 to 10 lakhs rupees just to try and keep them alive and stable. So liver transplant not only keeps them stable and alive but also cures the underlying problem, thereby preventing the need for further admissions. So liver transplant is not expensive and as you compare the cost benefit ratio, it is significantly better. The third myth is liver transplant is not happening in Gujarat. Now, Gujarat, yes, came into the picture quite late in the liver transplant program. However, nowadays, more than 5 centers are actually functioning with a full-time transplant program in Gujarat itself. A lot of corporate hospitals are now starting with the liver transplant, and I expect more and more hospitals to come into the picture. The success rate about the transplant teams for transplant is no different from the rest of the country. The next myth is that after liver transplant, you need to remain in a closed and a protected environment. Now, this is completely wrong. Once you get transplanted, you generally tend to stay in the ICU for a couple of days. After that, around 7 to 10 days, you stay in the rooms and understand the nuances about managing the medications after the liver transplant, and then you go home. For the next 2 months, usually we are advising the patients to stay away from crowded places. However, they can meet the relatives, they can actually go for a walk, and they can live a normal life. After 3 months, they can join their jobs, they absolutely live as normally as they used to live before they develop a liver disease. If they play a sport or they are climbing a mountain, they all are allowed. They can travel abroad, they can take a vacation, but the only thing is they need to take their medicines along and maintain the timing of the medicines. The fifth myth is that the transplant medicines are extremely expensive and they cost similar to the transplant. Now, yes, they do need to continue transplant medicines for the rest of their life, but the cost of the transplant medicines goes lower and lower as the distance from transplant increases. For the first 3 to 6 months, the usual cost is around 8 to 10,000 rupees per month for the therapy post transplant. However, after 6 months, the cost of the therapy goes down to around 5,000 per month. And this treatment is continued for the rest of their life. The survival rate is up to years and decades for which the patient might have to take the medicine, but they can live an active, productive life. So, liver transplant is a life saving modality available in India with a good success rate, no longer an experimental, not as expensive as compared to the West, and post transplant, the person can live normally. So, if your near and dear one requires a liver transplant, please don't get scared. Please contact to a hepatologist or a liver transplant physician or a liver transplant surgeon, and they will guide you through the process. Thank you.